increase in the incidence of diabetes and its implications.
What is diabetes? A quick introduction. My name is Merle Taylor and I'm qualified and credentialed in diabetes education, and I've been working as a registered nurse since 1978 and with people who have diabetes for more than 10 years. Educating people about diabetes and its impact on healthy living is my passion. I'm committed to giving people the knowledge and tools to understand and manage their condition into the future, to reduce the risks associated with diabetes and live a healthier and happier life. So what is diabetes? There are three main types of diabetes. Type 1, where the pancreas is unable to make any insulin, and it usually affects children and young adults, although people of any age can develop type 1 diabetes. Gestational diabetes occurs in pregnant women due to the extra load on their pancreas by the growing baby. This type of diabetes can go away after the baby is born, but it does put the mother at risk of developing type 2 diabetes later in life. Type 2 is the most common form of diabetes and can be caused by lifestyle choices, age, family history and cultural genetics, medication and other diseases. It is most often seen in adults, but children are also known to develop type 2 diabetes as well. In the following series of short animated videos, I will be explaining in simple and everyday language what diabetes actually is and how it affects your body, and how to live a healthier, happier life with diabetes. Follow the link below to the next diabetes education video.
Definition. Diabetes is a serious chronic disease that occurs either when the pancreas does not produce enough insulin, a hormone that regulates blood sugar or glucose, or when the body cannot effectively use the insulin it produces.
Diabetes refers to a group of conditions characterized by a high level of blood glucose, commonly referred to as blood sugar. Too much sugar in the blood can cause serious, sometimes life-threatening health problems. There are two types of chronic diabetic conditions: type 1 diabetes and type 2 diabetes. Pregnant women may acquire a transient form of the disease called gestational diabetes, which usually resolves after the birth of the baby. Pre-diabetes is when the blood sugar level is at the borderline, higher than normal, but lower than in diabetics. Pre-diabetes may or may not progress to diabetes. During food digestion, carbohydrates, or carbs, break down into glucose, which is carried by the bloodstream to various organs of the body. Insulin is a hormone produced by beta cells of the pancreas and is necessary for glucose intake by target cells. In healthy people, beta cells of the pancreas produce insulin. Insulin binds to its receptors on target cells and induces glucose intake. In type 1 diabetes, beta cells of the pancreas are destroyed by the immune system by mistake. The reason why this happens is unclear, but genetic factors are believed to play a major role. Insulin production is reduced. Less insulin binds to its receptor on target cells. Less glucose is taken into the cells. More glucose stays in the blood. Type 1 is characterized by early onset. Symptoms commonly start suddenly and before the age of 20. Type 1 diabetes is normally managed with insulin injection. Type 1 diabetics are therefore insulin dependent. In type 2 diabetes, the pancreas produces enough insulin, but something goes wrong either with receptor binding or insulin signaling inside the target cells. the cells are not responsive to insulin, and therefore cannot import glucose. Glucose stays in the blood. In other words, type 2 diabetics are insulin resistant. Here again, genetic factors predispose susceptibility to the disease, but it is believed that lifestyle plays a very important role in type 2. Typically, obesity, inactive lifestyle, and unhealthy diet are associated with higher risk of type 2 diabetes. Type 2 is characterized by adult onset. Symptoms usually appear gradually and start after the age of 30. Type 2 diabetes accounts for about 80 to 90% of all diabetics. Management focuses on weight loss and includes a low-carb diet.
Epidemiology. According to the Global Burden of Disease report for 2015, the prevalence of diabetes rose from approximately 333 million persons in 2005 to approximately 435 million persons in 2015, an increase of 30.6%. During the same interval, the annual number of deaths from diabetes rose from 1.2 million to 1.5 million.
Epidemiology of diabetes mellitus. As of 2016, 422 million people have diabetes worldwide, up from an estimated 382 million people in 2013 and from 108 million in 1980. Accounting for the shifting age structure of the global population, the prevalence of diabetes is 8.5% among adults, nearly double the rate of 4.7% in 1980. Type 2 makes up about 90% of the cases. Some data indicate rates are roughly equal in women and men, but male excess in diabetes has been found in many populations with higher type 2 incidence, possibly due to sex-related differences in insulin sensitivity, consequences of obesity and regional body fat deposition, and other contributing factors such as high blood pressure, tobacco smoking, and alcohol intake. The World Health Organization estimates that diabetes mellitus resulted in 1.5 million deaths in 2012, making it the 8th leading cause of death. However, another 2.2 million deaths worldwide were attributable to high blood glucose and the increased risks of cardiovascular disease and other associated complications, e.g. kidney failure, which often lead to premature death and are often listed as the underlying cause on death certificates rather than diabetes. For example, in 2014, the International Diabetes Federation, IDF, estimated that diabetes resulted in 4.9 million deaths worldwide, using modeling to estimate the total amount of deaths that could be directly or indirectly attributed to diabetes. Diabetes mellitus occurs throughout the world but is more common, especially type 2, in more developed countries. The greatest increase in rates has however been seen in low and middle income countries, where more than 80% of diabetic deaths occur. The fastest prevalence increase is expected to occur in Asia and Africa, where most people with diabetes will probably live in. Effective treatment was not developed until the early part of the 20th century, when Canadians Frederick Banting and Charles Herbert Best isolated and purified insulin in 1921 and 1922. This was followed by the development of the long-acting insulin NPH in the 1940s.
Application in medicine. A 46-year-old housewife came from a village of Danishpur. While staying in the village, she used to walk at least 1 hour a day on her way to school and college. But after her marriage with a businessman, her lifestyle became changed. Her physical activity reduced, habituated with frequent rich meals, and in the stage of her life she became diabetic. Every few years of diabetes she took medication accordingly with regular follow-up, then discontinued her treatment. Later on when she went to dentist, She has been diagnosed as highly uncontrolled diabetes mellitus with hypertension and renal failure.
Diabetes mellitus is a disorder characterized by an imbalance between insulin production, insulin need, and the body's ability to use the available insulin. This imbalance can result from a total lack of insulin, from impaired release of insulin by the beta cells of the pancreas, from inadequate or defective insulin receptors in body tissues, or from the production of insulin that is either ineffective or destroyed before it can become effective. With uncontrolled diabetes, glucose cannot move from the bloodstream into muscles or fat cells, leading inevitably to hyperglycemia, which is a blood glucose level higher than the normal fasting blood glucose level. Diabetes also leads to starvation of those cells and a subsequent increase in the breakdown of fat and protein as the cells seek alternative sources of fuel. Diabetes mellitus is currently classified into two primary types, type 1 and type 2. Type 1 diabetes is characterized by a total lack of insulin caused by the destruction of the pancreas's beta cells. Type 1 is thought to arise from interaction between a genetic component and an acquired or environmental component, predominantly in response to an autoimmune process. Type 1 diabetes probably develops over the course of years, with beta cell destruction happening well before the disease is diagnosed. Diagnosis is usually in childhood. Because it results in virtually absolute insulin deficiency, type 1 diabetes is treated with insulin injections. Type 2 diabetes is far more common than type 1. As with type 1, the pathophysiology of type 2 diabetes involves both genetic and acquired factors. Among acquired factors, obesity and physical inactivity are of paramount importance. The metabolic abnormalities that lead to type 2 diabetes include insufficient secretion of insulin by the pancreatic beta cells, peripheral insulin resistance, and increased glucose output by the liver. In type 2 diabetes, hyperglycemia develops despite the availability of insulin. Type 2 diabetes usually manifests in adults older than 40, although it is being diagnosed in increasingly younger patients. Type 2 diabetes mellitus can often be controlled by diet, exercise, and oral hypoglycemic agents. People with type 2 diabetes mellitus may or may not require insulin injections. Regardless of the underlying cause of diabetes mellitus, blood glucose control is disrupted and glucose builds up in the blood to abnormally high levels, making the person hyperglycemic. Although there is excess glucose in the blood, the glucose cannot enter the cells and the cells are starved for energy. The liver recognizes the cell starvation and initiates gluconeogenesis, further increasing blood glucose levels. In hyperglycemia, glucose that should be used as energy within the body's cells is instead excreted through the kidneys in the urine. This is called glycosuria, a common sign of diabetes. Unable to utilize the blood's glucose, the insulin-deprived cells, starved for energy, begin to metabolize protein. This leads to the loss of intracellular potassium and phosphorus and to excessive liberation of amino acids. As osmotically active molecules of glucose remain at elevated levels in the blood, an osmotic effect between intracellular and extracellular fluid leads to severe fluid loss. Called osmotic diuresis, this dehydrating effect draws excessive fluid from the cells, or glucose, contributing to further hyperglycemia and glycosuria, which leads to even greater electrolyte imbalance, even as the kidneys become increasingly unable to process and excrete the rising levels control involving an absolute or relative deficiency of insulin or disrupted insulin reception, leading to hyperglycemia, osmotic diuresis, and progression to life-threatening complications.
Pros and cons. Pros. There's a considerable progress in treatment for diabetes at the actual moment. Diabetes is a well-known disease. Cons. Patients have a lot of limitations in their feeding habits. If the diabetes is not treated, it could end with the patient's life.
complications of diabetes mellitus. The complications of diabetes mellitus are far less common and less severe in people who have well-controlled blood sugar levels. Conversely, some genes appear to provide protection against diabetic complications, as evidenced by the absence of complications in a subset of long-term diabetes survivors. Wider health problems accelerate the deleterious effects of diabetes. These include smoking, elevated cholesterol levels, obesity, high blood pressure, and lack of regular exercise. Acute diabetic ketoacidosis, hyperglycemia, hyperosmolar state, hypoglycemia, diabetic coma, erectile dysfunction, respiratory infections, periodontal disease. Diabetic ketoacidosis. Diabetic ketoacidosis, DKA, is an acute and dangerous complication that is always a medical emergency and requires prompt medical attention. Low insulin levels cause the liver to turn fatty acid to ketone for fuel, i.e., ketosis. Ketone bodies are intermediate substrates in that metabolic sequence. This is normal when periodic, but can become a serious problem if this will reveal significant levels of ketone bodies, which have exceeded their renal threshold. Blood levels to appear in the urine, often before other overt symptoms. Proper treatment usually results. Estimates of the prevalence of erectile dysfunction in men with diabetes range from 20 to 85%. Erectile dysfunction is a consistent inability to have an erection firm enough for sexual intercourse. Among men with erectile dysfunction, those with diabetes are likely to have experienced the problem as much as 10 to 15 years earlier than men without diabetes. Respiratory infections. The immune response is impaired in individuals with diabetes mellitus. Cellular studies have shown that hyperglycemia both reduces the function of immune cells and increases inflammation. The vascular effects of diabetes also tend to alter lung function, all of which leads to an increase in susceptibility to respiratory infections such as pneumonia and influenza among individuals with diabetes. Several studies also show diabetes associated with a worse disease course and slower recovery from respiratory.
Issue applied in Ecuador. In Ecuador, diabetes is affecting the population at increasingly high rates. The prevalence of diabetes in the population aged 10 to 59 years is 1.7%. That proportion goes up after 30 years of age and at 50. 1 in 10 Ecuadorians already has diabetes. Unhealthy diet, physical inactivity, alcohol abuse, and cigarette smoking are the 4 risk factors directly related to non-communicable diseases, including diabetes. Conclusions. It is clear that we are far from controlling the negative effects of diabetes on health worldwide. As the prevalence increases, we clearly need new approaches to reduce the burden of this disease on public health.